Hey guys, this is a follow-up podcast on the video that I posted yesterday. As you can see, this is of a lung pleura, and you can see let me get this playing here. You can see that the pleura is moving, but not everywhere. There's what they call a lung point here, and this is diagnostic of a pneumothorax. If you get a lack of sliding without a lung point, you can't diagnose a pneumothorax because other things can be causing the lack of lung sliding. But if you find a lung point, as there is here, then you can diagnose a pneumothorax. I'll pull up a still here and start drawing on it in just a second. But you can see as that pleura slides back and forth, you can see that there's a point that doesn't slide, and that's the start of the pneumothorax. This video here shows it just a little bit better. You can see the pleura and how it stops. From this point on is the lung point and where you have the pneumothorax. So you can see on this still here of a CT, it kind of explains it better. This is your probe right here. And if you have your probe on the patient's lateral chest here, you can see this is a pneumothorax here, of course. This is lung. You can see at a certain point you get part of the lung that's working and sliding, and then the part that's not sliding. And it's very sensitive, very specific for pneumothorax. But again, if you don't find a lung point, that you can't diagnose a pneumothorax. You can obviously be very suspicious, especially depending on the clinical picture. But again, other things can cause a lack of lung sliding. So here's the original, still from the original video, and you can see that this area here has the lung sliding, and then this area here is a lung point, or the lung part of the lung that is has a pneumothorax. So again, I hope you enjoyed this video, and I'm going to put in another plug for Core Ultrasound. It's an awesome site. Jacob Avila runs it, and go give it a try. I'm not affiliated with it in any way. I just like his work, and here it is.